On this plastic model of the spine here, we can see that we have a rather complicated shape. The orientation of the joints, of the bumps and knobs, the attachment points for the muscles, vary throughout different areas in the spine based upon the way that part of the spine moves. And here we have the spinal cord resting inside that hollow tube running down the middle of each one of these bones, and the peripheral nerves exiting through these little canals on the sides. Inside that canal is a bunch of other stuff. There's arteries and veins, there's ligaments attaching up into the nerve, the extra space is filled in with fat tissue. It's pretty full. Even minor shifts in alignment or positioning of an individual bone on another can create some stress on that nerve. And any type of stress, whether we're stretching it, like in this example, or we look at the other side, compressing, reducing the amount of space available for that nerve, it's going to alter the message traveling along that nerve. Every single cell, tissue, organ in the body is coordinated by the nervous system. Nerves bring information about the environment, both internal, like things like our organs and muscles, as well as our external environment through our senses. The brain processes that information and then sends commands back down through the nerves out to the body to tell the body what to do. Disruption in that communication system, either coming up to the brain or exiting from the brain out to the rest of the body, can have a very large impact on your overall health. Anybody that has a spine and a nervous system would benefit from being assessed to see if they need any chiropractic care. I try to focus my care based upon the whole body. Instead of just dealing with if your low back hurts, we're going to look at your low back and see what's happening with the low back. We're going to look at the entire body, from changes that might happen in the feet or the legs in terms of your gait, to looking at what's going on in the rest of the spine, because ultimately absolutely everything's interconnected. A strain in one part of the body will impact everything else to some degree. So just because the pain might be isolated in one area, or the numbness, or the acid reflux, or asthma, or whatever the specific issue is, we have to look at the entire body, make sure we attain balance everywhere in order for that to have the maximum impact on a patient's health. My calling is to expand everybody else's impact on the world by allowing them to be healthier and have better interactions in their life, families, and communities.